an overall examination of the baby. Looking at the color, they should be nice and pink, which will indicate that they're well perfused. We should check for any lanugo, milia, vernix, any birthmarks or bruising that happened during delivery, and make note of all of those. And then we can go ahead and start checking the head. We can palpate the bones and make sure that there's an open anterior fontanelle, and make note of any molding or caput, and if the sutures are overriding, we'd make note of that. Then we can look at the face and check the eyes for symmetry and the coloring, and just make sure that everything looks normal with the eyes. We can also check the red reflex with a light, and then we can also check the symmetry of the ears, make sure that those are at the right height, the symmetry of the nose and placement of the nose, and then we can check the mouth with a gloved hand. We can stick our pinky in the mouth and check for a strong suck, and we can check the palate to make sure that that is intact, and check for any lip ties or tongue ties. We can also check the rooting reflex by stroking the cheek, and if the baby turns towards our hand, that is a good sign. Then we can move on to the neck by checking range of motion, turn the head side to side, up and down, and look for symmetry in the neck. We can palpate the clavicles and make sure that those are intact and did not get broken during delivery. Then we can move on to the arms and check the range of motion in the shoulders and in the elbows, as well as the wrists. This will help us to determine the gestational age of the baby. And we can also check the pulses, brachial pulse, the radial pulse. And then we can look at the hands, make sure that there's 10 fingers, and make note of any palmar creases. If we stick our hand in the palms, the baby should grasp our fingers. So check for that. Then we can move back to the chest and just palpate for any masses. Make sure that the bones are not broken. Make sure everything feels nice and firm and normal with that. Then we can take a look at the genitalia and make note of anything that looks abnormal. Make sure that everything's intact, everything formed properly. If it's a male, we can check for hypospadias. We can also palpate the testes to make sure that those have dropped properly and formed properly. Then we can take a look at the anus, make sure that that is intact and patent. And then we can move on to the hips. We can test the Ortolani's mover as well as the Barlow's maneuver to check for any hip clicking. If we do hear clicks, then this could indicate some hip dysplasia, and the baby will need further evaluation with that. There should not be clicks. And then we can move on to the legs. We can check the range of motion of the knees and the ankles. Make sure that all the bones feel normal. We can check the feet for 10 toes, and we can check the reflexes. If we push on the ball of the foot, the baby should wrap its toes around our finger. And if we stroke the foot, the baby should extend its toes outward. And then we can flip the baby over and check the spine. We want to palpate the spine to make sure that it is formed properly and it is straight and everything is intact. Then we can flip our baby back over. And I didn't check the head lag reflex, but you can grab the baby's hands and lift it up a little bit. And then we are going to auscultate the heart and the bowel sounds. Just make sure that everything sounds normal with that. No murmurs, no abnormal sounds. And then we can check all of the vitals, check the heart rate at the pulses, the respiratory rate, the temperature. We can take the oxygen saturation of the hands and the feet. And then we can measure the head circumference and measure the chest circumference, as well as the baby's height. And we can weigh the baby, and that concludes our newborn exam.